Assalamu alaikum and welcome back to Medicower and to the How Your Body Works program today. Very much about learning about how your body works, what does it do and how do you look after it. Before the break I was talking to Dr. James Pickering, who's our expert in anatomy and who teaches anatomy at the University of Leeds. He's now left us to speak to my next guests, who are medical students. With me today are second year medical students Emily Bix and Neve Crevin. Welcome both of you. Thank you so much for being here. We're going to carry on the conversation about the How Your Body Works programme. The third part is always about how do I look after it. And I think what we want to understand a little bit more about is how the blood, not only what does it do, but how do we actually look after our heart and our blood. So I guess what I wanted to start off by asking was, why do we actually test blood? Because we're always having our blood tested.
We are, that's a very good point. And again, thank you for having us on the show. It's really great to be here. So I think if I start,
of course.
Your blood is a fantastic system. It's kind of considered not fully an organ, but it does so many things that it almost may as well be. And it can tell us a lot in just taking a bit of blood. So I know it's quite something that's quite regularly done if you go to hospital or if you
it seems like the automatic thing to do when you're not well.
It does, and because it is so good for helping give a diagnosis, because there's a lot of components in blood and things that can change when you're poorly. So you have different things in your blood, maybe some kind of salts, and that can maybe give an indication of how well your kidneys are working. That's something that on a blood test form is called use and ease.
Okay. And we hear that on lots of TV programmes, don't we? Use and ease, yeah.
You do, yeah.
Okay.
So that's one good indicator. That's one thing to look at, but it just gives you so many kind of lists of things that could be wrong. A blood test can also, as well as saying what is wrong, saying what's right is a very good thing for.
So apart from checking about your kidneys, are there I'm assuming there's lots of other things that you can check the blood for?
Yeah, so as Dr. Pickering mentioned earlier, we've got the three main components of blood, which are red blood cells, white blood cells and platelets. And as well as these components, we've also got lots of other really useful elements in our blood which can tell us lots of different things, as Neve has just said. So as well as all those three components, we've got things like nutrients, so we've got things like magnesium, we've got things like potassium. So there's lots of different things that we can assess the levels of and whether those levels are actually normal, within a normal range, or whether they're sort of higher or lower than they should be.
I know I'm going to be talking to one of the GPs soon about musculoskeletal problems and pain, and one of the things we're going to talk about is magnesium deficiency and vitamin D deficiency. Yeah. So these are things that you'd pick up from blood tests.
Yeah, definitely. So we sort of test the levels, and there's lots of different things that are called, they tend to be called markers. So we can say that this is a marker of, say, infection, for example. And there's lots of things like that which we can assess. And maybe the one most closely linked to the heart would be cholesterol. We tend to have a lot of blood tests which test for cholesterol levels, and that can tell us how healthy our heart is.
So what is it about cholesterol that helps us to know that? What are you learning about cholesterol in your blood tests, or what is it about cholesterol that indicates a healthy or non-healthy heart? Yeah,
so there's two kind of main types of cholesterol. I'm sure they're phrases you've heard before, you know, that bad and good cholesterol. It's something that maybe butter companies advertise.
That's right.
As saying
LDL and something else?
HDLs.
HDLs.
Yes. So those two types, one, as I said, is the good, which I believe is HDL, and then the bad type is LDL.
And why are they good and bad?
So the reason why they are good or bad is the LDL, so the bad cholesterol, gets deposited around your body and it just kind of sits there, whereas the HDL kind of picks it up and moves it along and brings it back to the liver where it can be digested and kind of dealt with. So bad cholesterol is bad because it builds itself up and can clog up in your blood vessels and the highways of your body.
So this is what leads to heart problems, and that's why we're talking about cholesterol in relation to the heart. So what can go wrong with the heart if we've got cholesterol building up?
So essentially the bad type of cholesterol, as Neve said, it deposits around your body, and cholesterol is termed to be sort of a fatty-like substance. And your body actually needs a certain amount of it, which is that good cholesterol that Neve was talking about. And cholesterol is used to make different things that the body needs. And in terms of where we get our cholesterol from, the liver actually makes as much cholesterol as it needs to carry out its functions. but the additional cholesterol seems to be the problem, and that's what we get from our diet.
Right.
So it's the dietary cholesterol which is the bad cholesterol effectively, and that's what can cause the problems in the blood vessels.
Don't fatty fishes like mackerel and cholesterol contain good cholesterols? Am I thinking of something else?
Yes.
Am I confusing that with?
No, so oily fish is something that's quite good because it contains high levels of those good cholesterols, which is what you want in your body. And I think, again, some kind of margarine spreads, I think sometimes mayonnaise advertise having those, I think they're called omega-3 and 6.
Right.
And they're
Yes.
supposedly very good for you. And you find them in fish and then just those kind of oils.
Salmon, tuna, those kind of things, aren't they?
Healthier
oily
options
fish,
as they're
mackerel,
often advertised, yeah.
So, when we're looking at where we get cholesterol from in relation to diet, what kind of foods should we be avoiding? Am I asking too much for medical students to tell me? Because I'm thinking about how can we help our audience to understand about the fats that would help us with cholesterol and wouldn't help us?
Of course.
Of course not. There's definitely lots of things that are commonly known about to be high in cholesterol. So there's your typical things like your fast foods, so lots of greasy food will be high in cholesterol.
Is that to do with what they're frying? Because I think palm oil is one of the things that we've been... And I hear such controversial information about palm oil nowadays. And I'm thinking... But we talk about fried foods because of the high fat content, don't we? But is the type of fat relevant or not relevant?
It's definitely relevant. So there's two different types of fats, or there's kind of three. There's not going to get into too much
we're
of the
not
chemistry of it,
dietitians, are we? Yeah.
but there's saturated fat and there's unsaturated fat. And things that are high in saturated fat is the bad fat, essentially. So you get really maybe greasy things or kind of a lot of cakes or biscuits, that
Samosas,
kind of thing.
pakoras,
Yes,
pretty
of
common
course.
in our communities.
Of course.
So those are the kind of things we need to... I guess this is why we're talking about reducing the fats and the cholesterol through not having them too often, because can't give them up totally, but
No,
we
it's
need
very
to be able
hard
to
to
have
do
them
that.
occasionally, maybe.
Yeah.
So what else would you give advice on in relation to diet and fats then?
I think the main advice is we're not trying to tell you to cut everything out that is bad for you. You know, it's about having that balanced diet that's always drummed into us. You know, having a mixture of protein and carbohydrate and fat and fruit and vegetables and things. So it's about eating those foods that are high in cholesterol in moderation. So not eating them too often, essentially. There's other foods such as egg yolk and cheese and butter and milk as well, which are high in cholesterol. But obviously it's not practical to cut those out completely. So it's more about recognising that they are high in cholesterol and then maybe sort of considering how often you eat those foods and maybe knowing about the damage that can potentially be caused inside as well is something that's really important.
Yeah, and it's also about how much of those foods you're taking on at the same time. So it's all very well if you're kind of eating them not very regularly, but if you're eating a lot of them, then that can still also be very detrimental. So as Emily was saying, it's about having the right foods in moderation as well.
Yeah, because it also links to weight gain, doesn't it? And then that in itself links to heart problems and all the other things that we know can go wrong. So let's say, for example, somebody hasn't been looking after their diet well, they have started to have problems with the heart. What kind of things can their diet link to in terms of heart problems?
Well, the first stage in cholesterol-related heart problems is something called atherosclerosis.
Well,
I'm not sure if it's...
I don't know if I can pronounce that.
It's a fancy term for blockage of the blood vessels, essentially.
Right.
So this cholesterol, the bad cholesterol, which we have too much of if you're maybe overweight or eating too much cholesterol, can deposit in the walls of the arteries that Dr. Pickering was talking about earlier. And essentially it would initially build up in a small layer, and then sort of gradually as time goes on and maybe your diet worsens or whatever, it would increase, the layers would increase, and blood vessels have got a bit in the middle. It's a tube essentially. So obviously if you're having deposits of cholesterol within that tube, it's going to reduce the capacity for the blood to flow. So you eventually would experience sort of a reduction in blood flow, which can obviously have detrimental effects to the body, with maybe some organs not receiving the amount of oxygenated blood that they need. So it can be a major problem, but atherosclerosis is the first stage of that.
And you wouldn't necessarily have symptoms with that until you started to have pain, perhaps? Is that right?
Yeah, that is correct. So obviously as that kind of size, it's called, the middle of those blood vessels called the lumen, so empty kind of space inside the tube. So as that narrows, as Emily was saying, the oxygenated blood, the amount of it you receive decreases. So one of the kind of first stages in having heart disease or heart problems is something called angina.
I think a lot of us have heard of that.
Yeah, it's something that's unfortunately becoming a bit more common. I think it's good that people are realising it, but it's something that if we could get the rates down, it would be fantastic.
Okay.
So angina is to do with a partial blockage of these blood vessels, and they're kind of just categorised into two, stable and unstable angina.
Okay.
They both involve kind of a narrowing of those arteries that supply the heart muscle itself. So stable angina is these attacks of angina where you get a bit of kind of chest pain and maybe find it a bit more difficult to breathe, that are brought on maybe by doing exercise. But it's not the same as a heart attack, which we will go on to, but in angina, in these attacks, I said, you get that chest pain, that kind of shortness of breath. They're the two biggest symptoms. You can feel a bit kind of nauseous with that as well. But in stable angina, you can rest, you can sit, and those symptoms will go away. In contrast to unstable angina, where these attacks of angina can just come on suddenly, and resting doesn't really help it as much. But just to clarify, if you're ever having chest pains at all, something maybe you've not experienced before, then it's definitely worth to call 999, because these things can be really serious and often happen quite quickly. So it's really important that if you are having these really tight, as Dr. Pickering was saying, your heart is in the centre of your chest, but if you're getting this central kind of crushing pain, it feels really heavy apparently, or tight, like someone's put a belt around your chest, then it's really important that you call 999 and explain.
So that's not a case of going to see the doctor, that's about an ambulance or hospital A&E?
Yes, like the first incidence of a really bad chest pain, don't delay. I think it's definitely safe to call 999 in that instance.
How does that vary to heart attacks then?
So a heart attack, as Niamh was saying with angina, it's a partial blockage of this blood vessel, so there's maybe some blood still getting there, but not enough, obviously. In contrast, a heart attack is where the blood vessel becomes completely blocked by this fatty deposits, which will be...
So there's no blood getting through?
No, essentially there's no blood getting through at all, and that's to the heart muscle. As Dr. Pickering was saying before, the heart contracts by itself, but obviously it needs the energy from the nutrients in the blood to do that. So with no oxygen coming into the muscle, it can't pump effectively, and the muscle will eventually die if it doesn't get the oxygen it needs quickly.
Much more serious.
So yeah, that is definitely an emergency situation.
Okay.
One of the big symptoms in that as well, fortunately I've never had a heart attack, but as alongside that kind of crushing pain in your chest, which is the biggest symptom, you can also get pain radiating up into your jaw on the left side and pain going down your left arm. They can come on quite quickly, unfortunately, these symptoms, and you often see people that have had them, or unfortunately having witnessed a heart attack, people kind of can clutch their left arm.
I think it's quite common to think about that, but the jaw one, I think not everybody understands that that's one of the symptoms as well.
It can be, just a pain, a really horrifically sharp pain going up into your jaw.
Okay, so these are good indicators for us why we need to really take on board the messages about cholesterol, because I think we hear about them all the time. We're always talking about healthy diet and exercise. I can't think of how many programs I've been on with Dr. Liz, and we've talked about, eating less and moving more, and we all know the theory. The reality, of course, is very different for many of us, and I guess this is just another reminder of why we do need to start taking that on board and trying to avoid these much more serious conditions, don't we?
Yeah, definitely. And by all means, we're not trying to scare you with all this information that we're providing you with. It's more of an educational tool, so that hopefully if you know the problems that could arise potentially, that then you can backtrack and sort of do something about the diet or whatever it may be. Exactly. So
the phrase prevention is better than cure comes to mind.
Absolutely.
If you'd rather deal with the problem before it gets to a stage where you really need some help, and it can cause you a lot of problems.
These are really good reminders. I'm really grateful that you're sharing that with us. The other thing that I've got on my list of things to talk to you about is to do with the blood and its pressure, blood pressure. What can you tell me about blood pressure?
So blood pressure is a measure of the force at which the blood is going around in your body. And I'm sure many of the audience may have had their blood pressure reading taken at a doctor's surgery, and they get given usually two numbers, one over another.
That's right.
They do. So the target blood pressure, which everyone says is a good blood pressure, is usually 120 over 80. So that 100 number is the top number, and that's called your systolic number. So that's the number at which it's the highest pressure at which the blood forces out of your heart. So systolic or systole is when your heart really gives a pump. So that's the biggest force, obviously, because your heart is having to pump hard enough to get that blood all the way around your body. Whereas the bottom number, the lower number, is called diastolic or diastole, and that's when the heart's refilling and relaxing a little bit. So the pressures are different.
So how much does it vary because let me rephrase that. How much of a variation leads to something not being right then? Because would everybody be 120 over 80, or wouldn't that vary slightly from individual to individual? And when does it start to become a problem?
Of course.
There's definitely variation between individuals. I mean, I think if you sampled, say, 20 people outside, all of them wouldn't have a reading of 120 over 80. It's just not realistic to expect everyone to have the same reading with different circumstances and things. When it becomes a problem, it's considered the reading of 140 over 90 is the reading that you would be considered to have high blood pressure. So in between that, obviously if you're heading towards 140, you would be probably monitored by the GP or whatever. But 140 over 90 is that figure where, you know, they may introduce medication and things to help with blood pressure, and that is the figure that's sort of defined as being high blood pressure.
So why is high blood pressure a problem?
So if we're talking about that kind of principle of having a tube, if you're trying to shove something through a tube at a really fast rate, you're putting a lot of kind of force and doing a lot of damage to the tube itself. So as it goes through, you can actually damage the lining of that tube.
I see.
And you can kind of get bits kind of building up and a bit of scarring, which can lead to kind of some other kind of maybe heart-related issues or kind of problems elsewhere in the body. So that's quite a big issue.
Then.
Yeah, and also you can get weaknesses within those walls. You may have heard of the term aneurysm. So that's where if maybe the pressure's high, the walls become weakened, you kind of get maybe a little bulging or outpouching in that kind of blood vessel wall, like a little blob along the line. And as that wall gets thinner and the pressure's increased, unfortunately you can get those bursting, and that causes hemorrhaging, that principle that Dr. Pickering talked about earlier, which can be really serious.
So how do we keep blood pressure at a healthy level then?
Well, again, it's going to be about diet. So it's been proven that salt, high salt diet can increase your blood pressure. It makes your body take on more water. So effectively, if you've taken on more water, that's going to be in your blood. So you've got more blood trying to get through the vessels. So obviously, if you've got more blood trying to flow through the tubes, it's going to increase the pressure. But
we need water as well, and lots of people don't drink enough water. So how do you get that balance right?
We do need water, and I think if we're talking about salt, sort of trying to control the levels of salt you eat will indirectly help control the levels of water. So just consider again sort of the foods that are high in salt, and sort of maybe try and eat those in moderation. We've got a guideline daily amount of, I think it's 6 grams of salt that you should have per day.
Hidden salts, aren't they?
Yeah, unfortunately, that's one of the things that particularly if you're buying things from supermarket, I know I prefer home cooking myself, but if you're looking at packets in supermarket, I mean, it takes maybe 30 seconds. I know that can add a lot onto your shop if you're checking every single item, but the government had introduced a few years ago something called the traffic light guidance. So it shows you on a packet, it'll give you an indication of how much of your daily intakes of the different kind of food components are on there. So things that are green tend to be quite good, orange not so much, and then red, it's quite high in a particular content, whether that be sugar or fats. So you can look at those kind of labels just to check. And
they do give recommended daily amounts on some of these packets as well, so often you can get those guidelines reminded of, can't you, of those things?
Yes.
And that'll be the 6 grams that we mentioned before, so that would be the recommended.
I guess the biggest challenge is when you add salt to your food at your meal table, and then you're eating something that's got hidden salts in it. And same with sugars and fats, isn't it? It's the same kind of thing where we've got to get savvy about how we learn to read these labels, and also home cooking is a better option for all of us, but the reality is that we don't always have the time or the energy or even, you know, the capacity to always do things at home.
Of course.
Or we're eating out. We want to be able to eat out as well.
Yeah, definitely.
Yeah, okay, so salt's absolutely linked to blood pressure issues. Anything else linked to blood pressure that we need to think about?
Sometimes stress, particularly when you're quite stressed. I'm not sure if you may have ever heard of something called white coat syndrome. It's something that I can definitely say I suffer from. When you go to the doctors or to an appointment and they take your blood pressure, because you get nervous and anxious about it, your blood pressure can go through the roof and give a very high reading. So it's easier said than done in today's world to say, oh no, don't stress about things, or try and relax. But there is a link between stress and things like heart attacks and high blood pressure. So it's trying to make sure that even if you do have a stressful life, maybe take some time out, meditation, prayer, exercise, go for a walk, that kind of thing, to try and help yourself relax, because it's quite a complex system of how your brain kind of regulates your blood pressure, but stress can have an impact on it. So it's making sure that you take time out of your day, if needs be, just to kind of relax yourself a little bit more. Yeah,
and also asking for help. You know, we often see it as a weakness, don't we, to ask for help when we're struggling with things, and actually it's a sign of strength a lot of the time that you can ask for help. So yeah, I hope people are, you know, who are watching this and think about that. That's one of the things that we also do need to do as part of taking care of ourselves. It also demonstrates to our families as well, especially if we're mums and parents, we demonstrate to children that, you know, there are positive ways of dealing with difficulties in our lives. And if stress is one of them, then we can demonstrate how we ask for help to support that too.
Of course, it's really important.
And you said prayer and meditation, all those things. Yeah, that's certainly something that I can relate to.
We can also come back to, sorry to interrupt you, we can come back to weight as well with blood pressure and exercise as well. So if you're heavier as well, you tend to have more fat around your organs, and this fat can actually put pressure on the vessels, so it can actually compress the vessels if you've got so much fat that it's sort of putting extra pressure on the vessels. So that's something to think about as well with high blood pressure, and sort of the regular exercise that's recommended by the government, sort of a certain amount a day as well, is something really important to consider.
And it's about the small steps, isn't it, that lead to bigger outcomes, I hope.
Yes.
And I'm no different to anybody else that's watching this show, constantly in this battle of having to think about how do we manage and juggle our lives on top of looking after ourselves. And I think I've had many a conversation with student doctors about how it's okay you telling us to do these things, but actually the reality is very different. And actually it's the support that we need until we get confident to actually take control of that ourselves. And I think that again is about asking for that help. And I know there's lots of programs out there that we can engage with. It's about taking the initiative and actually getting that bull by the horns and doing it, isn't it?
Definitely.
And I'm as guilty as everybody else in that category. So yeah, I can appreciate that. But it's still important for us to know about it. And I think part of the reason why I do these programs is to help encourage myself and others to think about, we know lots of this, but actually it's about how can we be motivated to think about it differently, and at the same time remember, because we need reminders a lot of the time of how important it is to recognise the importance of healthy lifestyles in order to look after lots of things that we take for granted, like how our hearts work. And it's only when something goes wrong that we start to think, you know, I should have paid attention a bit earlier. So let's hope we're sowing those seeds today that will germinate. Yeah. I want to come on to the subject of anemia, because that's also part of blood. And I'm conscious of the fact that I hear a lot of women in the community, in particular, when I'm chatting to people about, you know, they say they've got anemia. What is anemia?
If you'd like to lead on that one.
Anemia, I mean, there can be different types of anemia. The one that we commonly hear about is iron deficiency anemia. And this has symptoms including sort of tiredness, can be shortness of breath, and just general sort of not feeling yourself really. And obviously the name indicates iron deficiency anemia is caused by a deficiency in iron.
And I'm being told, but we've got a minute left to finish it, so we're gonna have to find a really quick response to this and come back to this.
Okay, yeah, of course.
So what tips would you give to people about how to prevent anemia? And then maybe I could get an overall tip from you about the care of your heart and blood before we end.
So obviously if you're deficient in iron and it's causing you to have anemia, it would be good to get some iron into you through your diet. So things that are good for iron are sort of things like green vegetables, so sort of broccoli, curly kale, things like that, and red meat as well. So they'd be the things that you could act upon yourself to increase your iron in your body.
If you're worried about anemia, though, I'd definitely say if you're really having maybe shortness of breath and really feeling tired quite a lot of the time, then definitely to speak to your GP about it, because that could be another reason why you are iron deficient, as well as your diet, and that is something that you'd need to address with your GP. It would start with a blood test, so it is definitely
so we come back to the beginning again. Any top tips before I let you go?
I think, as the show has kind of suggested as we've gone on, diet is essential really, and it's just sort of being aware of what's in the foods that we eat all the time, and sort of thinking about those guideline daily amounts really.
And exercise when you can. Try and get that.
Yeah, and small steps with it, you know, being realistic about it.
Yes, of
Thank
course.
you so much. I can't believe the time's gone so fast again. But I really appreciate you coming here, and we're going to see you again, I think, for our next programme on lungs, aren't we?
Yes.
Okay, I look forward to seeing you then.
Thank you
very
very
much.
Okay, everybody, that brings us to the end of the show. I hope you found it useful. Inshallah, keep an eye open for our other programs on how your body works, and inshallah, I hope to see you soon. Assalamu alaikum wa rahmatullah.